Good morning, Peter Goertz. I'm a psychiatrist. This is a brief practical synopsis about benzodiazepines based on my own professional and personal experience. And I didn't do any research or reading up for this. It's kind of off the top of my head, so some details may not be correct. I just want to give you a flavor. Benzodiazepines are used by many psychiatric patients, prescribed, off the street. And I myself, in 2017, I was stressed, not sleeping well, and I was prescribed Withdrawal temazepam for about 7 months for sleep. And that was helpful. However, it was quite difficult for me to get off of that and sleep well without it again. Acupuncture actually helped me at the time, and it took some time for me to start sleeping well again without the Withdrawal. Some psychiatrists do not, out of principle, do not want to prescribe benzodiazepines in an outpatient setting. To me, that seems extreme. I do want to, in general, minimize use of benzodiazepines, but we want to be pragmatic. Let's say if a patient has stopped drinking alcohol but is suffering from severe anxiety, really doesn't want to take anything else, it may still be better to give them a low dose of a benzodiazepine instead of them drinking. So things can be a balance, and we want to be pragmatic, and that patient may benefit potentially even from chronic prescription of a benzodiazepine, and if they're functioning well, that may be reasonable. Benzodiazepines can cause cognitive clouding, memory issues, falls, dependence, so addiction. In general, on the other hand, they're pretty clean drugs in my experience. They generally don't cause a huge amount of physical side effects like GI side effects or cardiac side effects. In pregnancy, there seems to be potential for them causing cleft palate in the embryo. Withdrawal of benzodiazepines is similar to alcohol withdrawal, so tremor, increased blood pressure, increased heart rate, seizures potentially, especially with the shorter acting benzodiazepines. The longer acting benzodiazepines tend to taper themselves, let's say Valium, so it's less likely to have a seizure from withdrawal from Valium than from Xanax, let's say. And delirium, so confusion you can get in withdrawal from benzodiazepines. Longer term, so after the acute withdrawal, longer term, there still may be quite some time before a person's nervous system readjusts. So it can be quite a difficult issue for patients to deal with to long-term stop using benzodiazepines. Benzodiazepines bind to the GABA A receptor. There's a binding site, and they increase the frequency of opening of chloride channels and lead to chloride influx into the neuron, so hyperpolarization of the neuron. Barbiturates, on the other hand, bind to a binding site on the GABA A receptor, and they increase the duration of opening of chloride channels as opposed to the frequency of opening of chloride channels like the benzodiazepines. Alcohol has no specific binding site on the GABA A receptor, but has a similar effect to benzodiazepines. So you can use benzodiazepines for alcohol withdrawal. However, to my knowledge, not for barbiturate withdrawal. So for barbiturate withdrawal, you would need to use, to my knowledge, a barbiturate. Potency is an issue with benzodiazepines, so different milligram amounts can have different effects depending on the drugs. Valium 5 milligrams, ballpark, is equivalent in potency, so an effect, so anti-anxiety effect, for example. Valium 5 milligrams is equivalent, ballpark, to Ativan 1 milligram, Xanax 0.5 milligrams, Klonopin 0.25 milligrams. So that's ballpark. Valium 5, more or less equivalent to Ativan 1, Xanax 0.5, Klonopin 0.25. So theoretically, you can replace If someone's using a total of 10 milligrams per day of Valium, you might be able to replace that with a total of 2 milligrams a day of Ativan. But the Ativan, and maybe the Valium too, but the Ativan more likely you'll want to give twice a day. So split up the dose into twice a day because of the shorter half-life. The half-lives, Valium ballpark 50 hours, Klonopin 30 hours, Ativan 15 hours, Xanax 10 hours. And the Xanax can be pretty difficult for patients to cope with because of the short half-life. And practically that means they can get withdrawal symptoms between doses even. So if you gave the Xanax twice a day, they might go into Xanax withdrawal before the second dose in the evening. And they may think, oh, that's my anxiety coming back, but it might just be actual withdrawal from the Xanax. Liver impairment can be an issue in patients, so remember LOT, lorazepam, oxazepam, temazepam. Those benzodiazepines are glucuronidated in the liver, so conjugated in the liver, but not otherwise metabolized, so not oxidized. And therefore, they tend to be more easy for the liver to cope with if there's liver impairment. Patients, in my experience, are very different. So some patients can stop and start, let's say, Klonopin without an issue. So no major withdrawal issues. But still, you want to be careful. You want to taper off whenever possible a benzodiazepine. But still, it's quite remarkable to me how different people are, how different patients are. Some people have a very difficult time tapering off a benzodiazepine. Others can do it quite easily and do well. Thank you very much.